The state giveth, the state taketh away. Those same teachers and state employees on the state health plan could expect to be paying more for health care soon. Officials say that's thanks to people living longer and higher prescription drug spending, driving up health care costs. One also says even after the proposed hikes, most state employees will still be paying a far smaller premium than most people who have insurance in private sector jobs. WECT's J.C. Caldwell has been looking into those price increases. J.C., how many people does this affect?
Well, Fran, these price hikes will affect nearly 750,000 people who were on the state health plan. But they will also get some new benefits too, including less time spent fighting with insurance to get approval for care. Those on the state health plan can soon see deductibles double, premiums potentially more than double, and they could also find themselves paying more for prescriptions. Officials say this is because the state health plan is facing a $500 million shortfall. The good news, officials say the out-of-pocket maximum, will stay the same, and plan leaders say if their new approach to surgeries works, it could lead to members paying close to nothing for a surgery that previously would have cost thousands of dollars. Now, a vote on the premium costs is scheduled for later this summer because the state health plan's leaders are waiting to see what money they'll get from the state. However, this week state lawmakers have proposed spending the same amount of money on the plan they previously have, so it wouldn't cover that shortfall. J.C. Caldwell, WECT News.